Well, a seventh wave of COVID-19 is underway in Ontario, driven by what doctors say is the most contagious Omicron variant yet, BA.5. So how big of a toll will this summer wave take on our healthcare system? The head of the Ontario Science Advisory Table says he believes hospitals will bend, but not break.
Rise in hospitalization, though, is the alarm bell that says probably more aggressive steps have to be taken. We're not there yet, but I think across the sector, if that starts to happen, you'll see people say much more aggressive steps are required.
Evidence does not suggest that the BA.5 variant causes more severe illness, but Dr. Fahad Razik says the variant's highly contagious nature could still do damage through the sheer number of people who catch it.
If you add additional admissions now because of the COVID surge, I do really worry about our capacity. Will we manage? We will manage, but it's not pretty in the hospitals right now. And we do know that under these kinds of strain, we're not able to provide the kind of patient care we want to provide. By everything we know, because of the degree of immunization out there, we don't expect the rise in hospitalizations to match what we saw in prior waves. Now, this is all speculative, and I will happily readjust my prediction even in a week if we start to see numbers that look like they're going in the wrong direction.
When it comes to what we should be doing, Dr. Razik says if you haven't done so already, getting your first booster shot is key.
So that is a really valuable booster dose that is available right now, and there are millions of people who haven't received it. I hope that the start of this wave will be the important precipitant, the kick, the catalyst for people to go out and get that third dose.
Second booster shots could be rolling out to some parts of the population later this month, and there's also optimism that newer vaccines that specifically target Omicron will start arriving in the fall. Meanwhile, health officials are advising people to once again wear a mask in crowded public places to help protect the hospital system, which Dr. Razik says he sees with his own eyes is under strain.
An uptake has begun, and the continued pressures we're feeling in terms of staffing and capacity are there.
Now, CityNews also spoke to Dr. Kieran Moore last week. He's Ontario's Chief Medical Officer of Health, and he believes that this wave will be less severe than the ones before it, and he's hopeful that our healthcare system will be able to weather the storm.